Anatomy of oral cavity. The first part of digestive system is the oral cavity. Oral cavity extends from lips to orthopharyngeal isthmus. Anterior-posterior lips and posteriorly orthopharynx. Anterior lips and posteriorly oropharynx. Oropharyngeal lips or pharynx. It is divided into two parts: vestibule of mouth and mouth cavity proper. Okay. The mouth cavity proper, which contains divided on the two parts, that is floor of mouth and roof of mouth. Here this floor of mouth is nothing but tongue. Here roof of mouth is nothing but hard palate. Okay. Many structures in the oral cavity. They are lips, buccal or cheek mucosa, and gums and teeth and retromoral trigone and hard palate, oral tongue. And floor of mouth. We have to see first the vestibule of mouth. Vestibule of mouth. It is a cleft external to the teeth. It has a slit-like opening. Here in the diagram you can see the pink marked structure or part is vestibule. Here it covered by externally by the lips and internally by the teeth and laterally by the cheeks. Okay, vestibule. It present externally lips and internally teeth or gums and laterally there will be a cheeks. Parotid gland, it opens at vestibule on each side near the second upper molar tooth. Then the second one is lips. Here the lips are covered by one muscle because the face will be covered by so many muscles. In that, orbicularis aureus muscle is covered by the lips. They are fleshy folds of orbicularis aureus muscle. Lips. Okay. It is externally covered by the skin and internally by mucous membrane. Okay. Here the meeting point of the both lips. Here the both lips meeting point is called angle of mouth. Okay. Then the red marking of the lips will be done by the non-keratinized epithelium of transitional zone. It is present between the skin and mucosal membrane of the lips. Because of the presence of non-keratinized epithelium, the red marking of lips will be done. Okay. Then there are numerous labial glands will be present in the lips. They are serosus, mucus and salivary in nature. The next second point is third point is cheeks and buccal mucosa. Okay, here the cheeks are fleshy flaps continuous anteriorly with lips. Okay, and run downwards and laterally. We can see or we can feel the presence of the cheeks. Okay, it will be run downwards and laterally, right? Then these cheeks will be compresses of buccinatory muscle. Here we can see the buccinatory muscle. The cheeks, there is a buccinatory muscle. My diagram is not that much good. You just see the muscle, buccinatory muscle and submandibular duct. These cheeks will be compressed by the submandibular duct. Okay, here you can see the orbicularis aureus muscle which is present in the lips. Okay, sorry, here it is not a submandibular. Sorry, here it is not a submandibular duct. It is a pad of fat. I thought that is a, it is compressed by the in the oral tongue, means the floor of mouth there is a presence of submandibular duct. I confused. Buccinate muscle and the pad of fat which is compressed by cheeks is it is compressed of these two. The gums or the gingiva, it is a fibrous tissue and it is surrounding the neck of teeth. Okay, and attached to the alveolary margins of maxilla and mandible is called gums. It is attached to margins of maxilla and mandible is called gums. Okay, then it is a fibrous tissue which is continuous with periodontal muscle, periodontal membrane. Periodontal membrane. It helps which fix the tooth to their sockets. This periodontal membrane is fix the teeth into their sockets. Then next one is teeth. There are two set of teeth. Okay, there are two set of teeth, namely delicious teeth and permanent teeth. First one is delicious teeth and permanent teeth. Okay, here delicious teeth are, it is also called as primary or milky. Primary or milky or milk, and permanent, it is a permanent teeth. Here we can, next point is, sixth point is retromolar trigon. Here we can see the in diagram retromolar trigon. It is present in between the upper and lower teeth. And between the upper and lower teeth there is a trigon. Okay, retromolar trigon. Here we can see it is small triangular area in the oral cavity. Okay, it is small triangular area in the oral cavity. It is present at the behind the last molar tooth. With, see here, it is last molar tooth. No, this trigon is present in the present base, which is present in behind the last molar tooth. Okay, behind the last molar tooth, so it's called molar trigone. Okay, retro means behind, no, retro means, so retromolar trigone, which is present in the behind the last molar. Okay, next point is the oral tongue, or it is called as floor of the mouth. It is in a crescent shaped area, means here the tongue will be this shape. No, this is crescent shaped area between the gingiva and ventricle surface of the tongue. Okay, the first opening of the mouth, there is a tongue will be visible, that is the floor of the mouth. That is the visible tongue is oral tongue. It is formed by meliohyoid muscle, subinguinal salivary glands, deep part of submandibular glands. These will be forms the tongue. And frenculum. Frenculum means we can see the behind the tongue there is a one midline. Behind the tongue there is a one midline, that is called frenculum. The next one is hard plate. Hard plate, it forms the roof of the oral cavity. Roof of the oral cavity. Salivary gland. There are 3 salivary gland. First one is parotid gland, which is largest salivary gland, which is situated in the retromandibular fossa. Okay, first one is parotid gland. Which is situated in the retromandibular fossa. Retromandibular fossa. Okay, then it is opens at the duct. Duct opens into the vestibule. Parotid duct, parotid gland or parotid duct. Okay, which opens into the vestibule. Opens into vestibule. And second one is submandibular gland. Submandibular gland is second largest salivary gland. Which is situated in the gastric triangle of neck. Gastric triangle of neck. Okay, we can see in the digestive system, gastric situated in the digestary, sorry, not gastric, sorry, digestary triangle of neck. Okay, which is situated in the digastric triangle of neck. The submandibular gland, which is present in the digastric triangle of neck. Okay, the duct opens into the floor of the mouth. Opens into floor of the mouth. Okay, the third one is subinguinal gland, which is situated below the mucus of floor of mouth. Third one is sublingual gland. Okay, it is situated below the mucus of floor of mouth. Mucus of floor of mouth. In the mouth, floor of the mouth means the tongue. Below there is a presence of mucus. In that the subinguinal gland is present. Okay, the ducts opens into the subinguinal folds of the mouth. There is in it 10 to 20 ducts are present here. 10 to 20 ducts are there. Opens on the opens up the subinguinal folds in the floor of mouth. Same in the floor of mouth.